Hi, my name's Holly. I'm gonna get started on the week 4 discussion post. Um, so basically, to describe my toolkit to you guys, the topic is um, the care of patients with chronic psychotic disorders. Um, so one of the biggest needs for this patient population are resources. Um, we have local resources in the Charlotte area that we typically point our patients to who don't already have resources set up. The two main ones are called Monarch and Amara Wellness. Um, Mental health and, lacking funds um, to get access to care has definitely sort of runs hand in hand. So places like Amara Wellness, they have sliding scales for our indigent patients or patients that have private insurance that aren't accepted. Um, so that's sort of how it's paid for. Um, or obviously, you can pay it without insurance, but that would be expensive out of pocket. Um, so, Care coordination plays such a big role in the care of this patient population um, because these patients, they have to have people who help them, stay on top of their care and sort of maintain their baseline of psychiatric functioning. Um, because when these patients are in an acute episode of psychosis, they're not caring for themselves. They're not they're not attending to their responsibilities. They may burn bridges with relationships. Not being aware of any of this, and so it's really important that they have a care team. One of the main ways that we do this in psych is through what's called an ACT team, which both Monarch and Amara Wellness provide. But an ACT team is an assertive community treatment team. It's a team that's comprised of different disciplines such as nursing, healthcare providers, social work. They also have peer support specialists and education and employment specialists that work with the patient. They can also provide obtain residential um, programs for these patients. So care coordination is such a big part in the care of treating or maintaining um, patients with chronic psychosis or psychotic disorders. Um, So, the role of the ACT team, they help patients attend their follow up appointments. Um, these can be therapy appointments, they can be medication management appointments, um, they can be on just checking on their overall well being. Um, a lot of the times, our patients with chronic psychotic disorders get long acting injectables to, maintain their baseline. And the ACT team makes sure that they receive this injectable monthly. Some of them are every 3 weeks, some of them are longer. And it's just an injecting of an antipsychotic that will release over the designated time frame. Um, and that's a lot of long-acting injectables are really cool for this patient population because they have to do this one time, either once a month, once every 3 weeks, um, depending on what medication it is. And this helps with compliance, and it's something that the ACT team, their caregivers can ensure that they're getting every month. It's not like they're having to take a pill every day, multiple times a day. Um, that sort of leads me into the stress that they face. Um, First episode, psychosis with chronic psychotic disorders normally occur between the ages of 19 and 25. So these people are, young adults getting started in their lives, and all of a sudden, they could develop, a first episode of psychosis. And so, this really is sort of a morale, a pride, a dignity just decreaser for them. Um, it it makes them not feel normal, not feel like their peers and the people around them. A lot of us are starting careers, getting engaged, starting families around this time, and when something like that happens, that sort of puts a pause to all of that. And so, basically that's a huge stressor, and having to maintain taking medications and all of that, that's not something that most 19 and 25 year olds have to do in order to stay behaviorally regulated. So you know this can lead to lack of compliance. It can also lead to just overall stress, which any change in neurotransmitter activity in a person with a chronic psychotic disorder can trigger an acute psychotic episode. Um, and the problem with this is, if you think about it, every time these episodes happen, a patient genuinely has to like reorient themselves back to themselves, back to reality, back to society, and this can be really stressful, particularly for some people within this age group. And it's kind of like learning to walk and talk again, but like every time this happens. So that's why the education and employment specialist is really helpful for these people, because they help them identify opportunities that will work with their mental illness, and that understand that they do have a psychotic disorder, and that they may need some hospitalization time away to sort of regroup, get themselves back together, and they would still have that job or educational opportunity to go back to. um, Another thing in stress, with this patient group is, the side effect of medications. Antipsychotics can cause some nasty side effects. The second generation antipsychotics can cause weight gain. It can increase their risk of type 2 diabetes, high cholesterol. They can also cause an inability to achieve an orgasm or obtain an erection, which is like particularly troubling for this age group. That's not an issue that this age group normally has. And so that can be, all of these things can be reasons that patients stop taking their medicines or don't take them as prescribed. And also, we can treat extrapyramidal symptoms, but we can't treat tardive dyskinesia. The anticholinergics do not work for tardive dyskinesia, and it's not reversible, and it's a cosmetic um, abnormality that could definitely be troubling, especially in this patient population. Um, so let me see if there's anything I didn't talk about. Oh, basically my role for helping this patient population sort of mitigate their stress and their care coordination is really being an effective discharge teacher. So I work in a psychiatric only emergency department, and so it's very important that, I add to the discharge teaching. I do so in plain writing. I remind them, what this appointment is for, not simply because the discharge paper will just print out like when and where and with who, but it doesn't specify for what. And a lot of these patients have different providers depending on, what appointment it's for, whether it's a therapy appointment or a medication management appointment. Um, Also, writing in plain language how they take their medications. Sometimes it'll print out saying take 75 milligrams of this, but they might not realize that's not just one tablet, that's 1.5. So, just sort of breaking things down for them, and just, helping them understand what each thing is for so that they're more apt to be compliant, because we don't want these patients coming to the emergency department for services that aren't emergency that could be done outpatient. And we also want to prevent these patients from having acute psychotic episodes, because we've talked about how stressful they can be, not only in the moment, but they got to clean up their messes, their consequences afterwards. And this can also be particularly stressful for their caregivers. Um, and so, sort of helping make sure they stay out of that acute psychotic state, um, is definitely how I personally, as an ED nurse, help them do that, is through good and effective discharge teaching. So, let me just do one more check, make sure I said everything. All right, cool beans. Y'all have a great week.